Hey guys, thanks for popping in and joining us today. We're going to talk today about choking and how to respond and recognize when someone is having a breathing emergency from choking. So choking is either a partial or complete blockage of the airway, and this can be through many different means, right? This can be being distracted or just talking in general while chewing or eating, which can lead you to actually choke on food. So we have in pediatric settings, especially infants and young children, putting things in their mouth and having an airway obstruction, right? So the rule of thumb here with choking is if the person has the ability to cough, cry, speak, or breathe, it's not a terrible situation. Obviously, it's not good, but it's not as bad as it can get. We want to encourage them, keep coughing, try to work it out. A moment might hit where they can no longer cough, cry, speak, or breathe, and that is when we want to begin care for choking. So with that said, care for choking is for the adult over 12 or heavier than 55 pounds. We're going to do series and combinations of back blows and abdominal thrusts. We'll do 5 back blows, 5 abdominal thrusts. This is what we used to call the Heimlich maneuver, the abdominal thrust, in which we pull inward and upward in that soft tissue area above the belly button between the ribs. So we'll we'll position on the side of the person, we'll arm across their chest, we're going to lean them forward, and that's where we use the heel of our hand to strike the middle of the back there and the upper back. We'll do 5 back blows. And then we follow that up with 5 abdominal thrusts, which is just, again, above the belly button, pulling inward and upward simultaneously. We'll do 5 of those. We're going to keep repeating those cycles until one of 2 things happens. So this only ends one of 2 ways. The object becomes dislodged. The person can now forcefully cough, cry, speak, or breathe. Or the person collapses, they're unresponsive, and they're not breathing. So when that happens, we would have to jump into CPR cycles, which we have another video on. When it comes to a child, the skill is the same for the adult. And remember, the child is between the age of 1 and 12, or they could weigh less than 55 pounds. So usually we call this anywhere from 1 up until about puberty or height, right? So if they're on the shorter side, you would do the same exact skill. The only difference is you would kneel next to them versus standing next to them like you would do with the adult. When it comes to the infant, and we do have a video on infant choking as well, which we'll walk you through step by step, is we're going to do a series of back blows and chest thrusts. So chest thrusts, we'll use a 2-finger technique right in the center of the chest below the nipple line, and instead of the abdominal, we'll just push on the chest versus the abdomen, straight inward for the chest thrust. When it comes to choking adults, we do have some modifications that we can do in place of abdominal thrusts. So always when someone is pregnant, we will do a chest thrust. So in other words, instead of being at the abdomen with that fist, we'll be in the center of the chest, and we're going to overlap that hand and we pull straight inward on the chest. So we'll do this for someone who's pregnant, possibly someone who's in a wheelchair and such that we can't get our arms around the wheelchair, and also someone who might be larger in size to a point where we cannot make a connection with our hands here. This is going to be really critical for the skill to give you enough force to pull in and up, right? So in other words, if we can't get around the abdomen, we'll slide up to the chest and do a chest thrust for those individuals as well. So hopefully you guys enjoyed the video today, found some value in that. We do have some other links, and on our page you can see we actually walk through what that looks like using equipment, and you can take a look at that for further information. Thanks for joining us today.